Some would argue a woman's breasts define who she is. And for the women shown in these pictures, it was a very unpleasant image.
Scars are perfect. They're awesome.
Dr. Bart Rademaker is a leading plastic surgeon in breast augmentations and implants, performing around 30 breast surgeries a month.
As we age, what happens is that the breast tissue kind of stretches out, the skin kind of stretches out, whether you have implants or not. For a woman, that's not, very pleasing to have, a breast that's hanging and a nipple that's hanging.
Dr. Rademaker is helping more and more patients like Marie Jones, who was unhappy with breast implants she received from another doctor. This is her before photo.
I was way too big for me, and I felt uncomfortable in my own skin.
6 weeks ago, Dr. Rademaker performed a reduction and lift on Jones, who is now very happy with her new look.
I was actually almost an E. I am now a C.
Dr. Rademaker says a lot of his patients, like Alex Stocks, want larger breasts, but are fearful of scarring. This is Stocks before surgery, a B cup. This is her today, a double D with no scars.
I make a very small incision about that size through the armpit and one of the creases. So, in fact, in most of my patients, you can't even see that incision.
They have completely changed me and my confidence, and I have no negatives about it.
And now to one of Dr. Rademaker's most challenging makeovers. This mother of three, including twins, asked we not show her face, but agreed to share this before photo of her natural breasts, which were deformed and caused her a lot of grief as a teenager and woman. This is her just 10 days after breast reconstruction, with no implants. The FDA has now approved silicone breast implants for all women, and Dr. Rademaker says they're a great solution for women with less breast tissue. A breast augmentation will cost anywhere from $5,000 to $8,000. In Tampa, Susan Casper, ABC Action News. Most would agree an imperfect nose is nothing to sneeze at. After all, it sits smack in the middle of our face. So it's no wonder so many people are obsessed with making it perfect.
I'm excited. I have a wedding coming up in the next year, so it's really awesome to have it done, and for pictures I feel like I'll look my best.
Ginny Humans is a 25-year-old bride-to-be and is in the final stages of correcting her nose.
It is hereditary in my family. It was just a larger nose, kind of more of a hump, and it was really just to kind of fit my face a little bit better.
Ginny underwent rhinoplasty 9 years ago, but her nose started collapsing. So she turned to board-certified facial plastic surgeon Dr. Michael Jason from the Jason Facial Rejuvenation Institute in Tampa for help. He's restoring the contour of Ginny's nose with a new FDA-approved dermal filler called Radiesse.
To do that, we inject deeper, so we're not just injecting into the skin like we would for typical fillers. This is being injected either on top of the cartilage or on top of the bone where the support has actually been lost.
Using a small amount of this calcium-based filler, Dr. Jason now molds Ginny's nose to her liking.
We get immediate gratification, and when we get to show the patient, like Jenny, what we're doing, and then we can get an opinion from the patient about whether they want more or whether they think they're satisfied with the filling that we've already done.
And in less than 15 minutes and without the knife, Ginny now has the nose she's always wanted.
I feel great. I love it. I feel like this is how my nose was supposed to look.
Unlike traditional rhinoplasty, this non-surgical procedure is not permanent. It typically lasts 12 to 18 months and will cost you less than $2,000. Tomorrow night, the latest on breast enhancement surgery. Susan Casper, ABC Action News.